the high walls of the ivory towers of medicine have started to crumble. And I think that is a bit of a dramatic metaphor for what we are saying here, is that we need to really reevaluate how will a doctor be a doctor in the 21st century? What will distinguish him or her and be deserving of that title as a member of the large team that will be involved in the healthcare of people? The focus of this meeting that we're having actually is what are the most important skills that will be needed in the future doctor. Obviously, he or she will need to be extremely well versed in the new way in which data is analyzed and in which technology is utilized to diagnose and treat disease. There are tremendous advancements in all of these fields. Nevertheless, there is also the need for the doctor to continue to know the stuff of medicine. In other words, how does the human body work? What is disease? What is cancer? What is inflammation? How do these things happen? And all of the hardcore knowledge of medicine, which underlies the major killers of today, vascular disease and cancer, among other diseases. But so the hardcore science part of medicine needs to be understood, but now with a much different curriculum that involves a much greater ease on the part of medical students in dealing with big data, with bioinformatics, with new technologies, with artificial intelligence, with all of those areas. That is going to be one area that's needed, but the other equally important skill that the future doctor will need in order to individualize care is to be able not only to individualize the physiologic or pathophysiologic part of the disease, but also to individualize the manner in which that treatment is going to be administered to the patient, to that specific patient. The very high technology is being achieved on the technological end, and they are tremendous in terms of from blood pressure monitoring to the genetics of cancer and the individualization of care and molecular medicine. At the same time, delivering those in a specific manner to you, I have to know your story. And your story and in which gives me the context in which to be sure that you do get that treatment and that I achieve my goal of healing you. And that whole field is the field of medical humanities and specifically narrative medicine, which will be the other major skill of the physicians of the future. And that this meeting starts to pose the problem of how we're going to deal with changing our curricula and the way that we approach things in order to be sure that our future physician is adept at both of these skills. The impact of the meeting is also to start this conversation not only here at AUB, but also regionally by bringing all the regional medical schools around us into the conversation as part of our role in AAHC-I. Also trans-regionally by the presence of the European AAHC-I ambassador with us and a lot of European input into this meeting, and of course with the United States as well. So that there is really a global conversation about the medical curriculum of the future that faces reality and takes into account the needed changes that have to be made in the formation of the new doctor. There will be a number of discussions that will illustrate how this new era of artificial intelligence and technology will actually democratize medicine, number one. Number two, and to me that's the most exciting, it will create an avenue for patients and doctors to have a direct one-to-one relationship with each other, just like we used to before. Okay? The onset of insurance companies and all of that intermediary profit-making industries that have hindered the relationship between doctors and patients, and in fact cut it off. Now with technology we can re-establish that relationship. The reason the relationship was severed between the doctor and the patient is not because technology severed it, it's because greed and profit severed it. And technology is going to can bypass those organizations which have introduced greed and profit into the doctor-patient relationship. and restore that relationship in a new way. This is the most exciting part of the revolution that's coming in medicine, to me at least. The medical futurist writes on the website, the advancement of digital technologies, IT, and the appearance of the internet with social media channels set profound changes in healthcare in motion. So for a successful leap towards the 21st century doctor-patient relationship, the future generation of physicians should be trained differently. And this is what this meeting is about.